everyone, my name is Christina Previtt. I'm an internal pelvic floor physical therapist, a weightlifter and CrossFitter, and the creator of the Return to Gymnastics Postpartum program. In this video, I wanted to go over an introduction to Diastasis Rectus Abdominis, DRA, or Diastasis for short, because it's one postpartum consideration that can create a lot of fear for women as they return to gymnastics postpartum, and it's also going to potentially influence some of a woman's timelines for returning to different skills in CrossFit. Firstly, what is Diastasis Rectus Abdominis, or diastasis? It's a widening and thinning of the linea alba, that line of connective tissue, that six-pack line, that occurs in 100% of pregnancies. The reason why this occurs is physiologically, we had to adapt a way for a woman's body to be able to handle the growth of their unborn baby. And so it is an incredible way that our body has adapted and evolved to allow the baby to grow in utero. Postpartum, there is a returning of the two rectus muscles, an approximation of the two rectus muscles that occurs. And for some women, that approximation or coming back together of those two rectus muscles can take a little bit longer, or the resting position of the two muscles can be a little bit wider than they were before pregnancy. There are a couple of things that we consider when we're thinking about modifications or when to progress through these gymnastics program, through our 8-week program, if you are presenting with some diastasis recti. Biggest things is that what you're going to see as you start to challenge your core is that you can potentially have what's called a doming or a coning across your midline. This is not something that is wrong. It is not something that is going to cause damage. I want you to conceptualize it as a signal. It is a signal that you are potentially going a little bit above where your pressure threshold is right now, because our rectus muscles have to adapt and contain the increase in pressure that occurs as we contract our core, which of course is a very important component to force transfer in our gymnastics movements. So if you are presenting with diastasis and you are seeing some of that doming or coning, just know that you're kind of reaching your threshold for this day or this week's programming. And let's hold there and make sure that you can progress when you can do all of your sets and reps without too much of that doming or coning occurring. The second thing that we're going to consider, and we're going to do a self-assessment or a tutorial on how to do a self-assessment of a diastasis in a moment, but what is considered normal in regards to this space between your two rectus muscles? There are two really important components to this. One is what's called the interrecti distance, which is the amount of space between the two recti muscles. The second thing is the spring, or the laxity in those muscles. So as you do something like a mini crunch, which I'm gonna show you in the self-assessment, you're gonna feel the two muscles of your core, your rectus, come together, and 2 finger breaths is what's considered quote unquote normal. So you might still feel like there is going to be some distance between those muscles. That is totally okay. The second thing we're looking for is like a springiness of the connective tissue. That means that you're really getting that force transfer across the front of your abdomen, which is so important in gymnastics, especially as you get into those kipping movements. What you're trying to work for, and what a lot of these core exercises that we're doing in this program are going to encourage, is that strength coming back across the linea alba. And it can take some time. And depending on how much diastasis recti you have, it may take a little bit longer. If you have a bit more of a gap, like a 3 or 4 centimeter gap, or less, you're also going to have a lack of springiness very early postpartum. So if you are 6 weeks postpartum, it is nothing to freak out about if you feel like you can really dig into that laxity. You can kind of keep going and it doesn't feel like it has a ton of spring. That is because your body is still healing. As we go through some of these foundational fundamental core exercises, some of that strength and stability will come back, and it's nothing to worry about. So let's go through the self-assessment so you can kind of see where you're at and hopefully know what to look out for as you progress through this program. Okay, so let's go through the self-assessment for diastasis rectus. So what you're going to be doing is first, you're going to go down that linea alba and just feel kind of resting tone. Everyone's body shape is going to be a little bit different, so you need to make sure you sink through any fat layer. You're going to have your knees up so that your back is nice and flat against the ground. And then you're going to bring your head and top of your shoulders off the ground in this mini crunch position. And you're going to see first if you see any doming or coning or popping up of pressure. That's kind of what you're going to be looking for during some of these gymnastics movements. Next, we generally check for diastasis in 3 positions. One is about 2 finger breadths above the belly button. The second is at the level of the belly button. And the third is 2 finger breadths below the belly button. So you're gonna start above, and you're gonna lift your head, and you're gonna feel the 2 sides of your rectus come together, and you're gonna see how much distance is there, and if you can spring into that kind of tension point, or if you feel like it just keeps going, almost like it's gonna feel like you're touching your intestines or something like that. You're gonna come back down, go to the level of the belly button, come up. I have a bit more of a separation at the level of the belly button, a bit less spring than I do higher up. Come back down, and then same thing at the lower level, feeling for that spring. Give that a try to kind of know where your baseline is in terms of diastasis.